Welcome, everybody. We are so excited that you have chosen to join us tonight or whenever you are listening to this recording, possibly much later. We are excited to be able to share about our programs with you. This is the Healthcare Professionals Information Session. We are doing a live version here for anybody that was able to attend. And then we are also doing this live online, and it is also being recorded. So just in case someone jumps into the session later on, that's kind of what's going on. So just to share a little bit of what we are planning to do this, or whenever you're listening to it. I'd like to just introduce a couple of people. Janet Mays is going to be sharing about some of the programs. She is our Allied Health Program Lead. And then I also have Beth here with us as well. She works in our operations team, and she's going to be sharing about financial assistance. We're going to cover that first. And I did have Christina on here, but she's not able to attend tonight, so I'll be covering her information as well. So the first thing that we're going to talk about, or Beth is really going to talk about, is all of our funding options. So the very first thing that I would say to you before she gets started is, if you have any interest at all in our programs, talk to us. There are just so many financial aid options available. Don't let that be a barrier. I know that the first thing that sometimes people think is, I can't afford this. There's no way I can do it. If you're interested, talk to us, and we can guide you through what's all available before you really even make that decision. So with that, I will also share, if you go to our website at laurelridgeworkforce.com and you look along the top ribbon, you will see funding and policies. If you scroll over that, you'll see the drop-down menu pop up, and you'll see all the funding options as well as some of the other specific ones. So that is a great place to get started. If we go through everything tonight and you still have questions or still want to go back and look at things, that's really the best place for you to go. Or also, if you look on the bottom corner there, it says laurelridgeworkforce.com/funding. That's just a direct link to get to that place as well. So with that, I'm going to turn it over to Beth.
Good evening, or welcome everyone when you're watching this. I'm going to talk about the three major types of funding that we have available for students for the healthcare classes. The first one is something called Fast Forward, and that is available to residents of the state of Virginia. You have to have lived in Virginia for at least 12 months. You also have to be a U.S. citizen. The forms are very easy to fill out, but this will cut the cost of your class for those healthcare classes that do qualify down to just 1/3 of the full price class. So you can come into our office. You can also look at these forms online. So you fill out the top part of the form. You need to be careful and read the information on the first page and the second page very carefully, because that is where you are agreeing to be a successful student. So because these courses they have very stringent attendance policies, and so we need for everyone to understand that your grade is based on attendance in your class as well as completing the coursework. So we need you to read this very carefully, because what you're agreeing to is that if you are not a successful completer, that you will be paying the college back for 1/3 of the cost of your class. So that is the Fast Forward agreement in a nutshell. You also have to fill out the domicile determination form that helps us determine, are you really a Virginia resident? Because Fast Forward is like a grant from the state of Virginia, where they are helping out folks who live here in Virginia, who pay taxes in Virginia, who own and operate a vehicle in Virginia, vote here, things like that. So we would need for you to fill this form out too. And we're happy in the operations and registration department to help anyone who has questions fill that out. The last page of this form is the actual class registration. So this is where we get your personal information, your contact information, your phone number, your email, things of that nature. And if you do not qualify for additional financial aid, that's where you can let us know how you want to pay for your third of the class if you only qualify for the Fast Forward program. We also have a financial assistance form that can help you take your class down to $0. Of course, you still have to be a successful completer, or you still owe us that 1/3 of your full registration costs. So as far as the financial aid paperwork goes, you fill out the top form, you check your class that you're going to be taking. And then we always tell folks to refer to the chart at the bottom of page 2, because this is what will help you determine if you really need to fill this financial assistance paperwork out. It is based on your adjusted gross income from the previous year's taxes. So in this instance, we would be looking at what you made on your adjusted gross income for 2021. It is based on your locality, where you live, and the number of folks that you claimed on your income tax. So there is a chart that can help you figure that out. There are 2 different types of financial assistance. One is called FANTIC, the other is called G3. So you find how many folks you claimed and what your income was. And if you made less than that amount in that column, it's worth your while to fill this financial assistance form out. We can also help you determine if you should fill this out. Once you have determined that you need to fill this out, we are going to need a copy of a few items from you. We're going to need a copy of your driver's license to see that you do live where you say you live, and also for age verification. We're going to need some sort of secondary domicile verification, like a voter registration card, a utility bill, a bank statement. This also needs to have your name and current address on it. And then we would need a copy of your IRS tax transcript. Or if you get SNAP or TANF benefits, we can use that. So we need one or the other in order to look at your file and review you for qualifications for financial assistance. And then we just need a signature on page 4. So our forms are very easy to fill out. It's not like applying for other types of funding, and we're always happy to help in the operations department.
Awesome. So just a couple of things. Since some people will be listening to the recording later on, again, you can find that same form on our website as well, or you can come into our office and have the printed version. So either one is available to you. And Beth, can you tell me what it would be income wise for a family of 1 and a family of 4, just for those areas, just to give a realistic picture?
So for instance, for someone who claimed 1 person on their taxes and they lived in Shenandoah County in 2021, if that person made less than $27,180, or if they made less than $54,360, it would be worth their while to fill this form out, because they most likely would qualify for one type of financial assistance. Or also another example would be if you had 4 people in your household and say you lived in Fauquier County. If you made less than $83,250 or less than $111,000, it is still worth your while to apply for financial assistance.
Awesome. So as you hear, those numbers are quite high. It's different than what it has been at times in the past. And so all that to say is, if you've got any interest or need, please check out that information, because you certainly could qualify. And then sometimes we also have other scholarships available just based on the fact of where you live. And so I would say, come talk to us. Definitely check out the website as well.
Absolutely. We're happy to help.
Anything else with financial aid?
No, I think that's about it.
All right. Awesome. Well, thank you so much, Beth.
You're welcome.
We are going to transition next into pointing out just a couple of things. So like I mentioned, there's a lot of things on our website. So one of those things is our updated catalog. Those came out in the mail this last week. So if you didn't get one in your mailbox, You can also do the QR code that is now up on your screen. So if you use your camera and flash over that QR code, it should pull up the catalog right away. Or you can also go to our website. Again, on that top ribbon, under courses, I believe it's under there. Our catalog is also posted there. So what we are going to do today is walk through those catalog pages, and we're going to talk about each program a little bit more in detail. But before we do that, I also just like to mention, before we get started, where are the jobs? So my role, by the way, I'm a program manager, is to do a lot of the research behind what programs should we offer, how should we offer them, and what are employers needing, and what are the certifications needed, and tying that all together. So I am constantly looking at the job market data. So I wanted to share that with you guys, because if you go on to Indeed or whatever your browser is, to search for what jobs are available out there, these are the types of numbers that you would see. So I like to do a search for the past 6 months. So I pulled these numbers yesterday, and just within the Laurel Ridge region, you can see nursing assistants comes up #1 of needing 397 jobs, or there was the 397 job postings just in the last 6 months. And then you can see medical secretaries, which is kind of along the lines of our patient service representative program, and on down through there. We want to make sure that as you are looking for jobs, that you know that on the other end of this, there are going to be jobs available. Provided you successfully complete everything and you do and use the tools that we give you, you will be prepared to apply for these positions. I'm also very mindful as well. So for example, of like the phlebotomy category, you can see that there was 51 job postings. Well, I have to be very mindful of how many classes I put out there. That is a class that probably fills up the fastest. Not probably, it does fill up the fastest and the earliest. And so I could probably do more sections of those. But on the flip side of that, I want to make sure that there's jobs on the other side for the students that do complete the job, and not that we're flooding the market. I will also just share too, I did hear just a week or two ago that there's a lot of dental professionals that have stopped placing postings because they haven't been able to find qualified people, and they're feeling like it's a waste of time to even put the postings out there. So even though you see that the number is only 47 jobs, in the last 6 months, we put out about 16 students. And at this point, there's no one else really training in our area. So we're definitely not saturating the market. And all that to say is those numbers could actually be a lot higher than what it's even showing up in our search. The other thing that I like to share too is not just within our region, but also the surrounding counties. And I do that simply because if you're living in, like, say, Winchester, for example, it's not that much of a hike to maybe go up to Martinsburg or to go to Hagerstown. Conversely, if you live in Shenandoah County, it's not that big of a deal to go to Harrisonburg, potentially, depending upon where you live, or vice versa. So over in Fauquier, going over to Manassas is not that big of a deal. So I also like to kind of keep in mind that some students will travel, and being mindful of that. So for example, you can see again, nursing assistants, top of the list, or nurse aides, medical secretaries right under that. You can see some of those numbers drastically changing. So in this one, by adding the surrounding counties, dental assistants goes up to 263. So all that to say is, even if you don't find a job right in your local area or right down the street, there are jobs within, like what I like to do is about an hour radius of those locations. So just know that there are a ton of jobs out there in the healthcare field right now. So next we're going to go right into the nurse aid program. And I'm just going to talk through each of these areas more in depth. What I like to cover for sure is, what can you expect from the industry? What kind of job, like what does a nurse aide do? As well as what you can expect from our program, and just kind of talking through a lot of those details. So I'm going to go through each of the programs and kind of cover those. And then certainly if there are questions at the end, we can take those too. So starting out with the nurse aid program, this is an entry-level position within the healthcare industry. It is under the supervision of either an LPN or an RN. They work directly with patients. So we're going to talk about job duties here on the next slide, but I definitely like to share that you should register early for this class. There are requirements that you need to complete before the class starts. So you will have to do a background check and drug screen. You will need to do a physical showing you also the immunizations. So if, for example, you don't have your Hep B series, you need to have started that. And also you'll need your BLS CPR certification as well. So the sooner you get registered for these classes, the better, because like I said, there are requirements as a part of the class, and that is simply because clinicals are a part of the class. And so as a part of it, you will be going to clinicals. If you do have your catalog, you can see that these classes are going to be offered. There's 3 different sections scheduled for the spring. There's one in January, one in March, and one in May. There's 2 of those are at Middletown. One of those is at Fauquier. Those classes are 4 to 9 p.m. in the evenings. Certainly you want to check out that schedule as well to see if there are when those clinical hours are. Just to go in and share a little bit more about what CNAs do. Your duties could include helping patients with bathing. It could be obtaining vital signs. It could be helping them to eat. Incontinence care, helping them go to the bathroom, as well as monitoring just their intake and output of fluids. So CNAs are typically found in assisted living facilities, home health agencies, and also in the hospital. Many nurses, RNs, LPNs start out as CNAs, and it's a great opportunity to get your feet wet. Start at that entry level, maybe even work while you're in school. It also gives you the opportunities to kind of rub elbows with different professionals. So if you have, say, a strong interest in cardiology, and that is definitely a direction you want to go in, you can apply to, as a CNA, to the cardiology wing to work in that area, and just gives you great exposure to many of the things you could maybe continue on to. So it is definitely a great pathway to building your career. But I also know that many nurse aides start out as a nurse aide and they love it and they stay in that career. So all of those options are available to you, to whether you just want to start out or if you want to continue on. I will also just share that the application process for this program is just slightly different than all of the other ones. But if you go to that website at the bottom of this page, which is www.laurelridge.edu/nurse-aide, if you type that in and go to that website, it'll give you all of the information about that. And it also gives you the ability to apply now. Or you can also come by and talk to one of our credit advisors. And they can walk you through that process of what it looks like to apply. So like I shared, nurse aides can start as a nurse aide, stay as a nurse aide. They can continue on to get their LPN, they can get their RN, and definitely go down that nursing pathway. Or another option is that they can also pick up a medication aide certification. So basically, a medication aide is a nurse aide who can administer medicines or help patients administer medicines. So in order to get into this program, the only way you can get into this program is by having completed a Virginia Board of Nursing nurse aide program. There is no other pathway. There is also a DSS direct care aide, but there's very few people that have that. So generally speaking, I say you have to have your Board of Nursing have completed that program. If you have completed that program, then you can go down this pathway. So medication aides, just so you know, are typically found in long-term care facilities and assisted living facilities. And also I saw a posting just last week for the regional jail as well, which PS, that's a great environment to work in and comes with great benefits. They are typically not found in hospitals. So typically in the hospital setting, your LPN, RN, those are going to be the people that are going to be administering, not medication aids. This is a 68-hour program, which means it's pretty quick. This also includes clinicals as a part of the class. So they also have the same requirements as that nurse aide would. So you would need a background check, drug screen, again, physical, and BLS CPR just as a part of being in order to register for that program. So again, register early, don't wait, because there are quite a few things that you do have to complete before that class starts. Next is the medical assistant program, and I'm actually going to let Janet share about that one. So Janet.
Yes, I'm welcome. Thank you for having me. So the medical assistant program, it is a wonderful, kind of intense program. Depending on where you decide to register for your program, classes meet 2 to 3 times a week. All of our schedules are available online. There's classes that are starting again in the spring at all 3 of our campus locations. It is important that you have internet access. It is required to complete your homework, so you will need that to be successful. This is one of our longer programs. It's 160 hours in total, where we intend that it is all face-to-face interaction. Where our MA is going to be employed, mostly doctor's offices, maybe some specialty clinics like a specialty as far as medicine, urgent care centers, even with insurance companies. You will have a wide variety of fields to choose from. Again, like Anna was saying with the nurse aide, if you have a particular interest, you may want to apply to a specialty clinic like cardiology, orthopedics, neurology, family practice, OBGYN. There's just so many opportunities. You usually enjoy a set schedule with mostly daytime hours, usually not holidays or weekends. However, if you choose urgent care centers, you may have some weekends, you may even have some holidays. Usually, you also have the opportunity for 12-hour shifts, so that may fit your needs as well. So the things that we do in class, the things that we do learn basic phlebotomy, which is how to draw blood. We learn how to administer immunizations to different muscles and what amount is appropriate in each muscle, how to schedule appointments. You might be responsible for dispensing medication under the doctor's orders, phone in prescriptions. You can remove sutures or staples, take vital signs, get the patient's medical history. You also could have primarily front office duties where you're checking in, checking out patients, verifying insurance. A lot of medical assistants find that their first opportunity for employment is in the front office, where they're able to transition to the more clinical role as time progresses. These skills are done in class. You are each other's partner, and so these skills are practiced on one another. It is mandatory that you participate to ensure your success and your knowledge of how to take care of others. So the other program that I teach, and again, it is offered at all 3 of our locations for this coming spring, is the phlebotomy technician program. This is very intense. It's anywhere between an 11 to 14-week class, depending on holidays or other possible breaks in the schedule. It's going to prepare you for a career in primarily blood collection. However, there are non-blood collections that are within the scope of and the role of responsibility for phlebotomists, like urine specimen collections, throat cultures. Primarily, we do focus on venipuncture, which is collecting blood from the arm, and capillary sticks, which is finger sticks. This program is 55 hours. Your attendance is vital to your success because NHA, which is the testing organization that we use, does have a mandate as far as the number of sticks that you are required to have before you can test. Again, these skills are practiced on one another during class. Your participation is mandatory to ensure your success.
Awesome. Thanks, Janet.
Thank you.
Oh.
Phlebotomists are likely, they have a couple of opportunities for employment, which do vary a little bit. Phlebotomists have very flexible scheduling. You may find first, second, even in bigger hospitals, third shift hours, which may suit your work-life balance. You can also be employed outside of the hospital setting in labs, donation centers, physicians' offices, with insurance companies, home health agencies, or even skilled nursing facilities. So you do have a wide variety of patients that you learn how to interact with.
I will say though that in a lot of cases, many jobs are early in the morning. And that is simply because a lot of people have to be fasting in order to get their blood drawn. So it's not uncommon that a position could start at 4, 5, 6 in the morning, especially when they're going into the skilled nursing facilities to draw blood. Those typically start very early. There's not quite as many evening shifts unless very big hospital type of thing. Most are early morning.
Yes, they are more limited. You may even have a shift that starts even as early as 3 a.m., which can still help you meet those needs that you may have.
The great news is usually you're done by noon or so.
Absolutely, yes.
All right, so next we're going to talk about the patient service representative program. I really like to encourage people when they are looking for those jobs, like I encouraged you to do at the beginning. When you go into Indeed or whatever that browser is, type in healthcare or medical. If you type in just patient service representative, you are going to get some postings, but they're going to be incredibly small. So think vanilla versus chocolate and sprinkles. So if you start out at the very basic level with the vanilla and put in healthcare or medical and then sift through those opportunities, you're going to come up with a whole lot more. So there are a ton of titles for this role or this position. I've listed some of them here. And there's many more. So that's why it's important to kind of start really broad and sift through them. Also, in some of these roles, like for medical assisting, there could be a bunch of different job titles that you're not even thinking of. Maybe that suddenly as you go through that job description, you're like, oh, I can do this. So just know that there's a ton of opportunity out there. Start very broad. Again, it could be a unit secretary, it could be a medical secretary, it could be an office assistant. It just really depends on where you're applying. I simply chose patient service representative as a title for this program because that's the one Valley Health uses that is most closely related to this. But again, they also have other ones too that would fit the bill. So all that to say is I do encourage you to go look for jobs before you even start taking a program, just so that you can kind of see what's out there. And you can start looking for companies that you want to go work at. And so that you meet their qualifications, I'd encourage you to do that. So Janet kind of talked about some of the more clinical based programs that she teaches. So if you do not like the blood, the guts, the gore, that kind of thing, this is another option. So that front end person, as what we call the patient service representative, could be doing things from scheduling appointments, database management, greeting people. They're the first person when you go to the doctor's offices that says, hey, I need you to come sign in over here. What are you here for today? Checking people in. They also do the opposite, vice versa, of let me get your billing information and here's what you need. Do you need to schedule another appointment as they go out the door? They could also, depending upon the size of the office, they could be filing insurance, they could be faxing, although sometimes faxing is a little bit of a thing of the past, sometimes that's still necessary. And they could also be processing medical records. This program, if you've looked at it before in the past, medical terminology was separate from that. We have now included in it into the program. So just know that it is a pretty good portion of this class. And the reason for that is as you are working with different providers, you need to understand the language that they're talking about. Sometimes they'll say, this is what needs to happen, or this is the diagnosis. And you need to have a basic understanding of what in the world they are talking about without having to go to, hey, Google, what does this mean? Every once in a while, you might be able to do that and look something up, but generally speaking, you need to understand the language, and that's why we've included it. We also do practice in a EMR as well. It is a more generic one, but if you can understand how the flow of that works, how to put in a note, and those kinds of things, you'll be able to figure out an EMR wherever you go, because you'll have that basic foundation. This is a live online class, so it's completely live online. So we have a set schedule that you show up online to that class during that specific time in order to take the class. It's about 60 hours. And it does give you the ability to sit for a certification through the NHA for your Certified Medical Administrative Assistant certification at the end of the class. Next, we have dental assistants, and dental assistants are very similar to a medical assistant. They're working right alongside of those providers. And within our program, we do teach something called four-handed dentistry, which means the dentist is two hands and the assistant is the other two hands. And so if you've been to the dentist, there's usually someone else alongside of that dentist doing kind of a lot of the background things similar to the MA. They could be setting up the room. They also sterilize the equipment at the end. They could be cleaning up before the next patient comes in. They could be also working at the front office, as well as doing some of those clinical duties. Again, it depends on the size of that particular practice, but you could have a whole variety of different roles. You will earn your certification, your BLS certification, as well as your radiation health and safety. Again, you could be doing clerical or clinical roles. And a lot of these duties are very similar just in the dental world. You could also be doing the x-rays. And also you will talk, ooh, I'm sorry about that. Our light has just gone off. Oh, there we go. Sorry, it's on a sensor, so it goes off every once in a while. We didn't move enough. So basically you're assisting the dentist, whatever is needed, and whatever that looks like, you're kind of that person doing that. And again, there's all kinds of different areas that you could apply to work in. There's surgery, there's pediatrics, there's orthodontists, there's family practice. So again, it just depends on what your interest is in those specialties, but there's a ton of opportunity there. So we also offer the American Heart Association BLS CPR classes, and we also have Red Cross CPR classes as well, depending upon what your need is. We also offer ServSafe food protection manager certifications, and we have several online courses. A couple of just additional things that I like to mention. If you're at all interested in any of these classes, I covered some of the things, but I didn't go into a lot of the expectations that one you can have for us, or that also we can have for you. So I would strongly encourage you to check out our website at laurelridgeworkforce.com/HNTK, and that stands for Healthcare Need to Know. On that page, we have all of the student handbooks. We also have videos on there and frequently asked questions. I'd encourage you to do a deep dive into that page. Anything and everything we try to cover so that you know well in advance what that looks like. It's kind of what our contract, so to speak, is with you when you start the class. We are still in the process of updating some of those videos from Lord Fairfax to Laurel Ridge, so that's still coming, but the basic content is still the same. So at this point, they are still available to you, so I'd encourage you to check those out. We also have some other courses available, so if we use a platform called Canvas for a lot of our classes. So whether it's the live online portal, our dental radiation, health and safety classes are actually also going to be offered on Canvas starting in January. That's where a lot of homework is done. That is where you can find Zoom and a bunch of other things. And if that scares you to death, you're not exactly sure what in the world Canvas is, or maybe even what Zoom is, I'd encourage you to just check out those links. It kind of just gives you a good tutorial of the basics that you'll need to know. Those are found on our laurelridgeworkforce.com website as well. And along with that, I would say almost all of our longer programs do require computer and internet access. We have a bunch of resources available for that. You can go to our library, and sometimes you can loan those out. Your local library as well. Sometimes you can use the computers there as well. But the thing that I will tell you is there are times where we will flip a class from being online to, say we have inclement weather, and we are able to flip that online. So you need to be able to have close access to the computer and internet so that if there is weather, especially in January and February and March, you're able to join those classes and not miss out on that content or be absent because of that. So just know that that is an important piece and part of our class. So I'm just going to wrap it up with just saying thank you so much for joining us. If you have questions that we did not cover, I'd encourage you to reach out to us. The phone number is there. It's 540-868-7021. You can call us. You can come by our office. You can also reach out to us online. There's a bunch of information, contact information for Janet and I as well. Please feel free to reach out to us with anything that you've got, and we will do our very best to work you through, whether it's financial aid or questions about the course or even what the job looks like afterwards. Please feel free to reach out, and thank you so much for your time today and for your interest. Thanks so much. I'm going to stop the share and have a great day.